Now, Zimbabwe launched its COVID-19 vaccination program today, with the Vice President General retired Dr. Constantino Chiwenga volunteering to be the first Zimbabwean to get vaccinated. Abigail Tembo was there and she filed this report.
With so many myths and misconceptions around the Sinopharm COVID-19 vaccine, most people were wondering who was going to be the first person to get the jab in Zimbabwe. The question was answered this Thursday when the Vice President General retired Dr. Constantino Chiwenga, who is also the Minister of Health and Child Care, became the first Zimbabwean to get vaccinated, followed by his deputy, Dr. John Mangwiro, and acting permanent secretary in the ministry, Dr. Robert Muchiradima. Officially launching the vaccination program, Vice President Chiwenga called on Zimbabweans to continue upholding COVID-19 preventive measures.
As you might be aware, that Zimbabwe received its initial batch of 200,000 vaccines from the People's Republic of China. Today marks the launch of the vaccination program that is set to achieve a herd immunity of at least 10 million Zimbabweans. I have received my COVID-19 vaccine jab together with my deputy minister and my staff. Therefore, I urge all Zimbabweans to be vaccinated. More COVID-19 vaccines are expected in the country till the required quantities are achieved in the shortest possible time. When you have been vaccinated, it doesn't mean that that is the end. We must remain on guard.
Harare City Council Health Director Dr. Prosper Chonzi, senior doctors and nurses also got vaccinated this Thursday.
This just shows the confidence that I have in the vaccine and the whole process of vaccination. It is an additional layer of defense, especially for frontline workers. You have your PPEs, you have your knowledge, but if you then have a vaccine that works systemically, it will further protect you.
Ndazviitira izvi kuti ndichange kubayiwa since tichishanda pa-infectious disease hospital tiriso tiri pa-first line kuti ndive kuvewo protected pandine ndichishanda uye kuti vanhu vaone kuti vaccine inoshanda nekuti harisi vaccine rekutanga munyika munomu kunewo mavaccines akambouya vana typhoid echolera takabayiwa tiri ma-frontline workers havana dambudziko rakaitika uye hatisi kuona dambudziko riri kunyanya munyika.
I've been among the healthcare workers that have been managing COVID-19 patients since last year, when we recorded our first case in Zimbabwe. And because of the fact that I'm working in a health setting where COVID-19 patients are being managed, my exposure is quite high. So as a way of trying to minimize my risk of contracting the infection in the event of exposure, I had to make sure that I'm vaccinated.
The best way to prevent yourself is to get vaccinated. So vaccination is one of the oldest ways to prevent yourself from viral infections.
By the nature of our jobs as journalists, we are also frontliners and are every day exposed to the COVID-19 virus. And today we took the opportunity to also get the COVID-19 jab. After 3 weeks, we'll be back for the second vaccination. Abigail Tembo, ZBC News, Harare.